Welcome to the first PIPC webinar on patient empowerment. I want to thank all of you that are viewing us today, and thank you for participating with our patients, Laura and Letitia. I also want to thank them for being here today to share their views on their experiences. My name is Tony Coelho. I chair the Partnership to Improve Patient Care, which we call PIPC. Sara van Geertruyden is the PIPC's executive director, and she is here with me today as well. PIPC's members represent patients, clinicians, and other stakeholders with one common goal, and that is to engage and empower patients in their health care. As an epilepsy patient myself, I've struggled as to how to take care of my interests and my needs. When I was 16, I had an automobile accident, and a year later, at 17, I started having seizures. I didn't know they were seizures. I woke up after a seizure, after having been milking in the barn for a couple hours, and when I woke up, the doctor, the general practitioner, was sitting on me, and I couldn't speak, and when I could, I asked what was going on, because everybody was staying around and so forth, and they said they didn't know, and they were going to try to find out and help me out. Well, needless to say, after going to several doctors, none of them knew what my problem was. What I didn't know at the time is that my parents were told that I had epilepsy and felt that I was possessed by the devil. So after going through several doctors, I then went to witch doctors, and the witch doctors didn't cure my seizures either, or solve any of my problems with epilepsy. And so I continued to have seizures during all these years. And finally, when I decided to enter the Jesuit seminary to become a priest, a doctor told me after the exam what my problem was. He said, "You have good news and bad news. The good news is that you're 4F and you don't have to serve in Vietnam, which was 1964. And the bad news, you have epilepsy and you can't be a priest, because Catholic Church under canon law at that time said that if you have epilepsy or possessed by the devil, you can't be a priest." That was established in 400 AD, so there was little chance of me trying to get it changed at that point. Then after that, I felt great, because now I could take medication and I could have an impact on my seizures and maybe have very few of them. And I trusted my doctor because he was the first one that I went to that told me the truth after 5 years of having passing out spells. And the reason I bring that up is that families have a huge impact on determining what you can and cannot do, particularly if you're 18 and younger. And then your church has a tremendous amount of influence. In my case, the church felt that I was possessed, and my family, believing in the church, followed that recommendation. So I then started struggling with my life, and I finally came to terms and said that I would never let anybody treat me the way I'd been treated. I couldn't get a job. I lost my driver's license. My family rejected it, and so forth. But then I finally decided to take matters into my own hand and be an advocate as a patient to find out what was going on, what I could do better. And then I ended up working for Bob Hope, the comedian, and then went to Washington, and I became the chief of staff for a congressman, and then ran for office myself. Epilepsy was an issue during the campaign, basically saying I really couldn't do the job, and I openly discussed it, got elected, and then I started working on disability issues and trying to make a difference. Ultimately, authoring the ADA, Americans with Disabilities Act. And so I've been an advocate all the way through, and since I've left the Congress, I'm very involved with disability groups to make sure that those of us with a disability know what to do in situations where we have a problem. So my recommendation always is to make sure that you know you're the only one, as a patient, who really knows what your situation is. And it's important that you educate your doctors about who you are, what you are, and how you feel about yourself. And once you do that, your doctor can become educated, or you can decide that that doctor is not a good one for you and move on to somebody else. So that's my story, and I'd like today now to introduce Laura Roix and Letitia Brown-James, who will each tell us their circumstances and how they've handled their personal situations. Laura?
Thank you. Thanks for letting us speak to you today. I'm a patient with idiopathic pulmonary fibrosis, also known as IPF. In 2006, I had gone to a pulmonary doctor because I was being told every year that I had pneumonia, and I thought something wasn't right with that. So in 2006, I went to a pulmonary doctor to find out what possibly might be wrong. He told me that with asking a lot of questions and with a CAT scan, he told me that I had scarring in my right lung, but not to really worry about it, that he didn't think that it was going to spread anywhere, because it seemed that since I was having these x-rays that showed a scar, which they thought was pneumonia, that he thought I might have had it for a while and didn't think that it'd spread. I went to see him about every year or every 2 years until 2012, and he would keep saying to me, don't worry about it, it's not going anywhere. And in 2012, in February, he told me it had spread. Not only had it spread in my right lung, it was also in my left lung. But he also said, don't worry about it. In November of that year, I decided that I had a cough and I couldn't get rid of the cough. Part of my IPF and my symptoms is a major cough. So if I start coughing, I apologize first. And I started coughing, and I was a power walker at the time, and I just could not walk without having to stop and cough. So I really wasn't liking the answers that I was getting from this doctor that I was seeing, so I sought out another one. And I went to another pulmonary doctor who told me that pulmonary wasn't my issue, that my issue was sinuses. So I went to a sinus doctor who told me sinus wasn't my issue, it was gastrology. So I went to a gastrologist who told me that gastrology wasn't my issue. Why wasn't I seeing a pulmonary doctor? So I had gone full circle. That gastrologist gave me the name and actually set up an appointment for me to another pulmonary doctor who did a biopsy on my lung and diagnosed me with IPF. That was in May of 2013. And he said, don't worry about it, I'll take care of you. As a patient, I had decided that that really wasn't a route that I was going to go. I wasn't going to sit back and not worry about it and let someone take care of me without me knowing exactly what was going on. I did research out on the internet, and I found a website called Patients Like Me, in addition to a couple other websites, and I started blogging. I asked patients who are just like me, who have the same disease that I have, for help. I was pretty desperate, and I wanted to know that there was something that could be done, because I was told by this pulmonary doctor that I had a terminal illness and that I had 3 to 5 years to live. That's what I also found out on the websites. So the patients told me to get myself to what they call a center of excellence for lung diseases. And that's what I did. I sought out a center of excellence, which really is a hospital that does research and also looks into specific lung diseases. And I found myself at that particular center, and that started my journey. That center gave me options. They told me things that I could do. They told me that I could fight for myself and that I didn't have to just sit back without having any options whatsoever. The only option that I really had at that point was to go to a lung transplant center, which they sent me to. And I started the evaluation process. Thanks to that center of excellence and thanks to the patients out on Patients Like Me, I was able to advocate for myself. I was able to ask this team of doctors a lot of questions and find out what it was that I could really do. Patients like me also sent me on another journey. Because of all that, I decided I was starting to blog really heavily. I was trying to help others, like some had helped me, in telling me what I could do and giving me suggestions as to where I could go. So patients like me asked me if I would do up a summary of my journey, which I did do, and I sent that off to the Food and Drug Administration. The FDA at the time was looking at 2 drugs that could possibly slow down the progress of IPF in our lungs, and they were looking to determine if they could approve those drugs. I was chosen as one of 4 patients to speak in front of the FDA to discuss what it was like living with IPF, and I'd like to think that we made an impact on them, because in October, that was in September of 2014, and in October 15th, they passed the approval of those 2 particular drugs that do slow down the process of IPF. I decided at that point that I still was going to fight. I'm now in an evaluation. I'm now in the program for the lung transplant in one center. I've also been evaluated. I'm now in the process of being evaluated in another center. In addition to that, I'm in a clinical trial. I decided that I needed to fight for me and for others, and I also went to, I was asked if I would speak at a college where I live with second-year medical students to discuss critical care, so I went ahead and did that, and I'm so very grateful that I'm also here today to be able to speak to you. So I think that one of the biggest things that we need to do as patients is to open up and to be communicative with the doctors and ask them questions. The 2 doctors or the 3 doctors that I had seen before that really didn't diagnose me, there's over 200 different lung diseases out there, and they can't remember them all. And what they do really is they basically look at people with COPD or emphysema or asthma, so they really don't get into the specialty, different types of other lung diseases. And even though idiopathic pulmonary fibrosis, over 120,000 people are diagnosed with it annually, and over 40,000 die every year with it, even though for me that's a really large number, it's not a large number to others. So I have to keep trying to educate people. I have a local doctor, pulmonary doctor, that if he doesn't seem to know the answer, he looks it up, he researches. So he also is learning along with me as to what IPF is. And I am so very forever grateful to them, so that I can have the opportunity to be able to go further with a lung transplant, or with these drugs, or maybe with the drug that I'm currently on with the clinical trials. So thanks for listening to me. And Letitia, you're on.
Hello, my name is Letitia. I've been an epilepsy patient all of my life and suffered with seizures throughout school, college, graduate school, work, and I, like Laura, out of sheer desperation, turned to the internet after seeing many doctors and not getting answers of what type of epilepsy that I actually had, why they weren't showing up anymore in the EEGs and MRIs, but I was still having seizures, and they were getting worse, becoming more frequent and more violent. And so eventually I turned to the internet and also found patients like me. And on the site, I was able to learn from other patients, other treatment options that were available. For example, having a 72-hour EEG done to try and find out what type of seizure activity that I was having. And eventually I learned about an epileptologist, which is a neurologist who specializes in epilepsy that is hard to diagnose and treat. Prior to that, I had seen several general neurologists, and eventually went to see an epileptologist, like I said, after learning about it on the site. And it was there that my life started to change for the better. The epileptologist sent me to the hospital for a week to do different things to induce the seizures. He explained to me very thoroughly that the type of epilepsy that I have is the refractory epilepsy, meaning that it's hard to diagnose and treat. And the only way to find out exactly the type and what the treatment options are is to do different things in an inpatient setting to induce the seizures while I was connected to an EEG machine. And it was during that 5-day stay that they were able to formally diagnose the type of seizures that I had and came up with a treatment plan for me, which led to epilepsy surgery. Prior to the surgery, I had to go through several pre-tests to make sure that I would be able to function normally after having the surgery. And, the team that I had were very open and honest with me. I was able to ask questions. I asked them questions based on things that I had learned on my own, being an informed patient, finding out different options and the success rates of the options that were available to me. And then I had surgery done on August 16, 2012, and I have been seizure-free ever since. It will now be 3 years this year, and I have made it one of my passions to educate patients by helping patients understand that you do have a voice. And although your physician or your medical team are experts in their profession, you are the expert on yourself. So if you are not satisfied with the type of care that you're getting, or you feel like something is just not right with what's going on, you can inform yourself by learning what's available, advocating for yourself, asking questions, like Laura said, maybe switching to a different physician who will be open to having you as a part of your care team so that you can have the best treatment options that are available for you. I currently serve as a patient research advisor on a team of advisors that Patients Like Me launched last year. There were 13 of us, and a part of our role is to help educate patients. We recently completed a best practices guide for researchers of how to best incorporate patients into medical research and include the patient voice. Because like I said before, as the patient, we have a perspective that no one doesn't have unless they've gone through what we go through. And even in that, each patient is different, and what may work for some patients may not necessarily work for others or for you in particular. So it is our responsibility to be informed and to advocate for ourselves so that we can have the best care possible. Thank you.
As you can see here, both Laura and Letitia have taken it upon their own to make sure they're getting the care that they need for themselves. So they've questioned and so forth. So as we get into, Sara will now give a little more about the substance of what we're talking about. But as you're going through listening to Laura and Letitia and myself, and then Sara when she gets through, we're going to try to get questions from you. We want you to participate and ask your questions, write them down, or send them right now to SHEA at PIPC, PATIENTS.org. Shay at PIPCpatients.org. I'll say that again, SHEA at PIPCpatients.org. O-R-G. So, Sara?
Great. Well, thank you very much for viewing today. So just a little bit of an overview of what I'll be talking to on these next few slides. We're going to be talking a little bit about the background of patient-centeredness, building a patient-centered healthcare system, and how to be an empowered patient. And so I think the first thing we want to touch on is, why does patient-centeredness matter, and why is it gaining increased attention? And this first slide really gets to the issue of the average patient is not necessarily you. And this idea of what it means to be patient-centered was really pushed by former CMS Administrator Don Berwick. And the quote that we have here is, Leaving choice ultimately up to the patient and family means that evidence-based medicine may sometimes take a back seat. And as we all know, oftentimes the research that's done in any particular area of health, it may tell you what works on the average patient, but that doesn't necessarily mean that it meets the unique and individual needs of the single patient that's looking for their treatment options. And so why does patient engagement matter? Engaged and active patients experience better health outcomes and incur lower costs by helping to define the care that is best for them. This is proven, I think, not only in the evidence, but it is intuitive that if a patient is engaged and active in their care and they're bought into the treatment that has been prescribed to them by their physician, they're much more likely to be adherent to it. Also, meaningful patient engagement requires that patients trust in the system and their care providers, participate in shared decision-making, and recognize the benefits of taking an active role in their care. I think the key piece of this statement is shared decision-making. And one of the things I hope that we can talk a little bit more about at the end is, what does shared decision-making really look like between a patient and a physician in that encounter? Factors influencing patient-centeredness. You may have heard of these new comparative effectiveness research. The Patient-Centered Outcomes Research Institute is an organization that was created in 2010 to do comparative effectiveness research. It is something that can give patients more information, but I think we are all proponents of being very careful that that information is also not used to limit patients' choices. Value-based payment models, which were also advanced by the Affordable Care Act, can encourage one-size-fits-all treatments, or it could encourage patient-centered care. And I think what we're here to talk about today is how we can all play a role in advocating that information support patient-centered care as opposed to promoting the kind of one-size-fits-all treatment solutions that may otherwise be the outcome. So now we have policymakers that are very much focused on patient-centeredness, and you'll hear this buzzword a lot, I think, in the next few years. CMS and CMMI, which is the organization that manages the Medicare and Medicaid programs, they're seeking the triple aim in U.S. healthcare, which includes patient experience as one of the objectives. So if you think about the triple aim, it's improving care quality, it's improving the patient experience with care, and it's lowering costs. And I think the fact that we have patient experience as one of those components is a very positive step. PIPC was also created in 2010, as I discussed earlier, to change the culture of research to better respond to patient needs, outcomes, and preferences. You'll note that the research that PIPC puts out requires researchers to engage with patients, to allow patients to help with not only topic generation, the development of the questions, but also the research design and ultimately its dissemination. The FDA has also increased their focus on patient-reported outcomes and engagement, which you heard a little bit about just now from Laura. And so I think that has been a real positive model for how we can promote patient-centeredness within government programs. Part 2, building a patient-centered healthcare system. What parts of the healthcare system can impact how patient-centered my treatment is? So here you see a picture intended to sort of demonstrate that patient-centeredness is not something that happens once. For the healthcare system to be patient-centered, it really needs to be embedded in all parts of our healthcare system. For value-based payment models to support a patient-centered health system, they must be built upon strong pillars of patient-centeredness. That includes things like patient-centered outcomes research, which is something that PIPC is working on, patient-centered dissemination tools, which is something that is also an objective of the Patient-Centered Outcomes Research Institute and other organizations, and support for shared decision-making, something we talked about just a little while ago, but I think thinking about how we support shared decision-making between physicians and patients. And then these three pillars must be layered upon a foundation of patient-centered data. And as you heard Laura and Letitia talk about, they have found that database in organizations like Patients Like Me. So building that strong infrastructure, By integrating patient-centered principles throughout the building blocks of our healthcare system, the system will deliver valuable, high-quality healthcare. And if the fundamental components lack patient-centeredness, so will the health system upon which they are built. And so what we really want to be promoting is we need patient-centeredness in our research, so patients need to be engaged in developing those questions and communicating to researchers and to organizations like PCORI what the questions are that they feel like would help them most in improving their care. But it doesn't stop there. That research also then has to be used in a way that promotes patients' choices, and the information needs to be distributed in a way that's understandable to the patient so they can make decisions about how that particular treatment option affects them personally. So when you think about the doctor-patient relationship, patient-centered care must improve patient health with a focus on outcomes that matter to patients, be directed by physician and patient shared decision-making, enable patients to conduct personalized assessments of treatment value. And when we talk about personalized assessments, we mean things like, how is this going to impact my ability to work, to take care of my children, the impact on fatigue, depression. So these are some of the kind of patient-centered outcomes that we mean when we talk about the ability to make personalized assessments. And then utilizing evidence-based decision support tools. There are a lot of decision support tools that are being developed, but I think it's up to us as patients to be able to say whether or not they're working to support our encounter with the physician and to drive better care. Patient-centered outcomes research. Patient-centered outcomes research must account for the diversity of patient populations. So just in speaking to our participants here, you know that patients are all very different and have different needs. Use open and transparent processes. Support the continued development of and access to medical advances, and recognize rare and orphan diseases. And when talking about the patient-centered infrastructure, we look at evidence-based medicine, which would require transparency to the patient. So when you're being told that a certain treatment option is best for you, the question then becomes, do you understand where that information is coming from and how your provider may have come to that conclusion? Consideration of patient-centered outcomes. So as we were describing before, things like fatigue and the ability to take care of your family or go to work. Accessibility to patients. Is the information or the evidence accessible to you and understandable by you? Application and use of evidence to improve health through shared decision making. You're going to hear us talk a lot about shared decision making as sort of the ultimate goal of patient empowerment. And then measuring and improving the value to the patients, not just the process of care. So a lot of times what we find is in the healthcare system, there are certain measures that health systems will use to determine whether they are successfully being improving health or being patient-centered, that are really more about process and less about whether or not the patient felt like that experience was positive. And so now we get into the more detailed discussion about how can you be an empowered patient? How do you become an effective self-advocate when the system is so complex? And so these are just a few of these are the three themes that PIPC really rallies its discussions around, and it's giving choice to patients, giving voice to patients, and advancing value for patients. So when you are in your physician's office, communicate your personal preferences and circumstances to your doctor. Research available treatment options so that you can ask about them while you're in the physician office. Ask why your doctor recommends a particular treatment to you. And that gets to the issue of transparency, being able to understand where that information is coming from. Be wary of any doctor that does not seem to consider your preferences or circumstances. Follow up about any difficulties that you have with your treatment. If you find that your treatment is causing fatigue or keeping you from being able to function in some way, that's something that should be communicated with the doctor. Be aware of new innovations and ask your doctor whether they could be right for you. In terms of your insurance coverage, if your insurer denies coverage for a treatment or is charging you a high copayment, demand to know why and consider asking for the evidence that supports that decision. Ask your insurer if they use value-based payment models such as bundled payments, clinical pathways, shared savings, or pay for performance, and how this may be impacting your care. One of the challenges with patients that I think is often they don't understand what the drivers are behind the care that they're being prescribed. So our goal is to help convey to the patient that it's okay for you to ask those questions and to know what it is that's behind the scenes driving the care that you're getting in the physician office. And then in terms of how to instigate change, at PIPC we advocate that you vote with your feet. So change providers or insurers if it's appropriate. Connect with other patients like you, just like Lara and Letitia have done with patients like me. Get involved in a patient advocacy organization. I know we at PIPC would welcome all of you to provide to us your questions. Tell us what things you think that we should be focusing on in our work. What could we be doing that helps you have a bigger voice in the healthcare system? Write letters to your congressman and engage with elected officials. As you know, healthcare is always a hot button topic on Capitol Hill. Both in the agencies that manage Medicare and Medicaid and among your members. So do not ever hesitate to have a voice and to let them know what you think or where you feel like the system perhaps is not meeting your needs. And so that's the end of our presentation for today, and I will turn it back over then to Tony to moderate a discussion, and thanks to everybody for listening.
Thank you, Sarah. Very informative. Thank you very much. I just want to say that those of you that are listening to this, if some of this is going a little bit too fast for you, next week, early next week, we'll have this on our website so that you can go back and review it in case there's something that you'd like to listen to again, just to make sure that you're doing what you felt you wanted to do. So we have questions coming in from California, Michigan, Washington, D.C., so I encourage all of you to keep them coming. The first one is from Michigan, and it's to Laura and Letitia. It sounds like you both came to a point in your treatment when you came to question whether you were getting the best care possible for yourself. How did you become comfortable with the idea of confronting these shortcomings? And what advice do you have for other patients like me?
I think, Letitia had said when she spoke that I became desperate. I just didn't like the answers that I was getting. So in order for me to look at any options, I needed to be able to make an educated decision as to what I wanted to do for me. And laying down and dying was not an educated decision as far as I was concerned. So I had to educate myself as to what my disease was and what my illness was and what the options were out there. And as I researched more and more, the more I found I had questions. And the more that I realized that I needed to find answers to those questions. I believe I was very lucky, even though it took me from 2006 to 2013 to find the right answer. Once I found that right answer, that I had idiopathic pulmonary fibrosis, I then found something. We live in an age of network sites, and it's wonderful because I found some places where I could find other patients that had already been where I am today and even where I am now. And they gave me a direction to go in. And when I went in that direction, I knew that I was lucky. The team of doctors that I had at the Center of Excellence kept asking me over and over again, do you have any questions? And they listened. They listened to my questions. And they gave me the answers to those questions, or they gave me options.
But basically what you're saying is that other patients gave you the encouragement to question
Yes.
your doctors and question
Most definitely.
yourself,
Right.
question yourself so that you could get the right answers.
Yes.
Yes, and in my case, similar situation, finding other patients like me who had tried surgery and other options for epilepsy, and looking at the statistics, the success rates of the different therapies and the type of specialist that I needed to see, and just realizing that for all my life, not getting the right answers or being informed by my physicians, my old physicians, about the treatment options that I had. And when you get to a point where you're just tired of something happening to you over and over again, like the saying goes, when you're down, there's no other way to go but up. So that gave me the drive and the will. I'm a pretty assertive person anyway. And, my philosophy is, it is my insurance, I'm paying for it, my copay, I am the consumer, so I should be satisfied with the product or the services that I am receiving. And so I just went in there and asked the questions, and when I realized that the last physician did not have the answers, I found out that I needed to see an epileptologist, so I went to see that doctor.
But again, you're saying, Letitia, that it was basically because of other patients encouraging for you to get your strength to ask the right questions and to question.
Right.
There's nothing wrong about questioning your doctor as
Right.
long as you're listening, and make a switch if that doctor isn't providing you what you need. But make sure you know what are the right questions to ask.
Right, and to make sure that you're getting the best services or the best treatment possible for whatever the condition is that you're dealing with.
I think the thing that's happening here is that instead of just sitting back and letting somebody else tell you what to do, you're participating. That's what
Yes.
patient engagement is that we're involved in the process now.
Mm-hmm.
We have the right to ask questions. We don't have to sit back and just take it. We have the right to ask questions of our family. If you're 17 or 18, or if you're an adult, you have the right to ask all these questions.
Yes.
One of the biggest things, Tony, that I think we both learned is that whatever journey or direction we go in, what may be right for me doesn't necessarily
That's
mean
right.
that is what's right for you. So I may go the route of lung transplant, Letitia may go the route of
Right.
surgery, but it doesn't mean that those are avenues for someone else. However,
and I go the
as long
avenue
as-
of medication.
Right,
so.
Right.
Right.
Okay, let's ask a question of Sarah. It's from Washington, D.C. Medicare right now is finalizing rules for accountable care organizations, which include requirements for those organizations to support patient engagement and patient-centeredness. What do these terms mean to the patient panelists? So we'll ask each of you as well. And what should CMS be doing to ensure that they lead the way on patient engagement? So you want to answer, and then we'll have both.
So last year, actually, the Centers for Medicare and Medicaid Innovation put out a public comment, a request for public comments and information on techniques and tactics for beneficiary engagement. So when they enter into contracts to do innovative payment and delivery systems in Medicare or Medicaid, they actually require the folks that they contract with to engage beneficiaries. But the devil is in the details, of course. What does that really mean? And they don't have a lot of requirements around those provisions. And so I think that's a very good question that, frankly, policymakers are still trying to figure out. And I think that the organizations that are engaged in these innovative payment and delivery models are also trying to figure out what that means and where the patient voice is most constructive and meaningful in terms of how they develop their plans. I will say, I think, whether or not the patient voice is called for, I think it's very constructive for patients to elbow their way in if they have to, simply because there are so many innovative payment models out there that do have an impact on the types of care that's being prescribed and the treatments that are being delivered. So it is important for patients to understand what those drivers are, what the financial incentives may be. And hopefully along the way, we'll see some think hopefully we'll see some more robust requirements around that beneficiary engagement provision.
Well, and we are at PIPC trying to pursue that whole discussion, and we'll keep everybody informed. If you give us your emails, we'll keep you informed as to what we're doing and the outcome of such. So I'll go to both of our patient reps. What does patient engagement and what does patient-centeredness mean to you? Letitia?
Patient-centeredness means to me that what I, as a patient, value for my health, it matters, and I should have a voice and a say in my care team. You know, the physicians are the experts in medicine, like I said before, but I am the expert in me. So being given options of things that work for me, and like Laura said, you know, what may work for one may not necessarily work for all or for another, but just being informed, like I said, doing your own research so that you go to your appointments with some knowledge and not just relying on what your team is saying, and making sure that you have an understanding, or if you do not understand something, feeling comfortable asking those questions and getting an understanding of your options, and if not, then perhaps finding out if you can find a team that will facilitate that and welcome your input as a patient, and you know, be that is patient-centered.
Laura?
One of the things for me that is very important is I have 3 teams of doctors, so I need to make sure that that each of them is giving me what I need. And being 3 teams means I'm working with a specialist at one hospital for my clinical trials and my normal everyday stuff with my lungs, and then the other 2 teams are transplant teams at 2 different centers.
So in other words, you're the quarterback for all 3 teams.
I'm the quarterback, absolutely, for all 3 teams. But I need to make sure that they know where I'm coming from and what I want. And I need to be consistent with that, so that with me being consistent with that, they're then consistent with what they're also telling me and what they're giving me. And the Center actually of Excellence for my clinical trials that I'm in also coordinates those efforts with the other 2 centers, with the transplant teams. And so it's very important that they know where I'm coming from. And as Letitia says, this is my body. I know how it's reacting to certain things. And the wonderful thing with these teams that I'm dealing with is no question to them is a crazy question.
But actually what you're saying that's really important for our viewers to know is that if you don't communicate to your doctor what you're feeling or what your concerns are, then you're the problem.
Right.
So
Absolutely.
you have to make sure that your doctor hears you out and that you say, you know, that medication or that surgery I don't like, or whatever it is, but you've got to educate your doctor. So that's your responsibility. That's what patient-centeredness is all about,
Right.
is that we take the bull by the horns and say, here's what's going on with my body, and the doctor won't know unless you tell him.
Right.
Right?
Right. And I have a disease that is not well known
Yeah.
to people. You know, when I walk around with my oxygen, people see me, they think I have emphysema or COPD because that's natural for someone to be with oxygen with that. And so I have to educate.
Okay, we have a question now from California. Thank you for sharing your stories with us today. This question is for Sara. What can regular people like me do to influence the policies that are being debated in Washington, D.C., to promote patient-centered care?
That's a very good question. Well, so there are several things that are going on here. We talked a little bit about accountable care organizations and the requirements around beneficiary engagement. And I think to the extent that as patients you have ideas about where you feel like you could have an impact and a voice on new payment and delivery models, particularly if you have a rare and less well-studied disease, I think that's very constructive to think about what the pathway is for you to engage that could be meaningful, and to encourage policymakers to require that kind of meaningful engagement. When I say meaningful engagement, I mean the kind of engagement that actually results in and real change in terms of how these payment and delivery systems work. Congress is also, on the House side, there is an effort in the Energy and Commerce Committee called the 21st Century Cures Initiative. They're working on legislation that would promote innovation. Patient-centeredness and patient engagement is a component of what they are talking about doing. It's particularly at this stage, I think, related to FDA and enhancing what the FDA has been doing in terms of better engaging patients. I think that those kinds of, that model, though, is something that should also be, we should be considering how it could be replicated in other public programs like Medicare and Medicaid. At the NIH, where research is done, and at AHRQ, which is the Agency for Healthcare Research and Quality. So there are, I think, a lot of avenues in Congress, too, for patient engagement. On the Senate side, the Senate Finance Committee has had a consistent focus in the last year, and I think will this year, on chronic diseases. They're very interested in individuals with comorbid conditions. So there may be opportunities in that legislative effort as well to talk about what it means to have a patient-centered healthcare system. And I think ultimately it really boils down to, and this is where I think you'll see PIPC's focus in the next year, is what are the pathways for patients to engage? And I think right now what we find when we talk to patients is that it's not easy to figure out where to plug in. It's just not easy to figure out how to have an impact on these broader policy discussions. And there should be. And so I think what we want to make sure is that policymakers understand that it's not just about putting out a broad, notice and comment in the Federal Register. That's not necessarily accessible to all patients. It's really about giving patients a more accessible pathway to weigh in on what's working and what's not in government programs.
I have a question here from Nebraska. How should shared decision-making tools adjust for different levels of patient readiness, such as cognitive status, trust in the health system? And the second question is, are there examples of shared decision-making tools that are considered evidence-based? So, Tisha, you want to start?
Yes, there are. For example, Patients Like Me does a lot of research and use the data of the patients that are on there to, evidence-based models to improve outcomes for patients.
I agree with her. There really are things on Patients Like Me that you can look at yourself and research.
Okay.
And just to add to that, Tony, in 2010, as part of the Affordable Care Act, Congress did also authorize the Innovations Office at CMS, where Medicare and Medicaid is. They authorized them to test these types of shared decision-making tools, and a lot of that hasn't happened yet. And that's actually another place where patient advocacy could be very effective, is to advocate for the Innovations Office to do more testing of shared decision-making tools, but not in the absence of patient engagement, because I think a lot of shared decision-making tools out there don't necessarily have patients engaged in determining the quality of those tools. And so it's very important that patients be part of the process of building and testing those tools.
Right, and it's also important for patients to find reputable clinical trials, that are FDA approved to participate, because that's where a lot of the answers for better treatment options and outcomes come from. When patients participate in trials, if patients are not willing to participate, then that can slow down the progression of new policies and treatment options that are available.
I'm sure we'll get a question based on that answer. How do people find out? How do patients find out about these trials?
Well, through your doctor offices, on the internet, you can find different websites and find out whether it's reputable or not, if it's backed up by the FDA, the reputation of the agency that's conducting the trial. Those are some ways.
Clinicaltrials.gov.
Okay, good. That's what we need to know.
One, yeah.
All right, good. This one is now, that one was from California, my home state, and this one is from Virginia. It's for Sara. We have a lot of work to do in learning what outcomes matter to patients, as opposed to physicians, payers, and our policymakers.
Right.
So we can build those into new product models. How do we get to that learning? Does PCORI provide a model for getting input from patients on endpoints that matter to them?
Yes. The short answer is yes. So the Patient-Centered Outcomes Research Institute has actually been they do, I think, a much better job than most research organizations, for sure, in engaging patients, not only in the generation of the research topics, but also then when they contract out for research, researchers are required to engage patients in determining what outcomes will be measured in the research. And ultimately, the goal is so that a patient, when they're looking at that body of research, can say, this is what the impact of this treatment versus that treatment was on a person that looks like me. So PCORI's doing some of that on the front end of research, and I think what's happening now is there are a few patient-centered outcome measures that are being developed that can then be used in payer systems, payment and delivery systems, to measure the impact of care. So these are quality measures, but patient-reported outcome measures that really look at things like fatigue or depression, or things that are more what we would call patient-centered. Now, the problem is that these kinds of patient-centered outcome measures, I think, that is evolving. There's probably not as many of them as we would like. And then once they are developed, having them embraced by payment and delivery systems is another challenge. But I do know Avalier, for example, hosted some roundtables last year looking at this issue of patient-centered outcomes.
Who is Avalier?
Avalier is a policy development organization here in DC that had convened experts in this world of patient-centered outcome measures to talk about how we not only build them, but also promote the use of them. So I think we're going to get some insights from them in the next few months as to how we can do more of that. But it's a significant issue that needs to be addressed, and patients need to be involved.
And to our viewers, when that is concluded, we can provide them information based on it?
Absolutely. We'll have links to that on our website.
Good. All right. Either one of you have any comment on that?
No.
Okay. This is now from Texas, so we're moving all across the country. What does shared decision making look like in practice when it's done well? Go ahead.
I was going to say a lot of collaboration, and respecting everyone's opinions, and, like I said, just collaborating on what the situation is at hand.
Communication, I think, is the biggest key for me, is communicating with the doctors, and the doctors communicating back. I think that, the days of we only have 15 minutes in a doctor session is over with. We need to be able to discuss with them especially when it comes to care that's not your traditional cold, and we need to be able to discuss with them and them be able to help us too. They are the experts, as Letitia said. They are the experts in the knowledge that they have, and that needs to be shared in both ways.
Well, my response to that would be when you feel you have control, when you feel you have influence, when you feel good about the care that you're getting. But it all comes down to you as a patient. You have to feel good about it. And it may not be something that Letitia would like or agree with, but it's what I like and what I think is right for me. Right. So that's really when you can determine success, is when you feel comfortable. A lot of patients today don't know what the answers are, don't know what the questions are to get the answers, and they're afraid to ask. So when you're willing to ask and you feel satisfied, then you succeeded. That's patient involvement and so forth.
I also would like to say, and I believe, and I don't know about Letitia, but my caregivers also were involved. Yes. And I think that's very, very important. And they also ask questions because they have questions from a different perspective than what I do.
Yes.
Okay, I think probably our last question is from Massachusetts. It's for the two of you. What are the most important lessons you can share with other patients? So what can we tell our viewers out there that you think is the most important thing?
Very simple. Speak up. Speak up for yourself. Be an advocate for yourself. And once you are that, then you will feel more comfortable in going
How do
forward.
you get there to speak up?
Do your research. I mean, the internet can be a very dangerous place to be.
Absolutely.
Right.
In looking in the internet, I have 3 to 5 years to live. I've already outlived that because I was diagnosed in 2006, and I intend to outlive even longer.
Yeah.
So you have to be careful as to what you find, and just take it with a
Don't
grain of
stop.
salt.
Don't
but
stop
don't
checking.
stop.
Don't stop
Absolutely,
checking.
don't
Keep-
stop.
Verify.
Keep going.
Verify,
Right.
verify,
Verify.
Yeah. Letitia?
And just to add to what Laura said, just trying your hardest to just speak up, even if you're afraid to. I mean, there's really no other way to say it than to just give yourself, the encouragement that you need to ask the questions that need to be asked for you to have the best outcome possible.
I think the most important thing is don't think that any question of your doctor is a bad question or a stupid
Right.
question.
Yes.
If it's something that concerns you, it is very legitimate to ask. And if they sort of look down on you because you've asked that question, change your doctor. Because you'll find a doctor who's willing to discuss with you whatever concern that you have. And so make sure that you feel comfortable in asking the questions and asking any question that you feel is important. That's critical.
Well, and that's a heavy challenge, just knowing the questions to ask. So, I mean, I think engaging with patient organizations can be very helpful in that regard. Engaging with patients like me. Those are good first steps.
And involving the caregivers too to ask questions.
All right, thank all of you for participating today. I really appreciate all the questions that came in. I know our panel does as well. And I hope that you've got the courage and the enthusiasm now to go and ask those questions of your doctors that you have that you were a little hesitant to do before. It's the right thing to do. It's we as patients need to do. Thank you very much.